one of the things that as we started planning for this forum, talking about pediatric education, pediatric nurse residencies, we began to have a conversation among ourselves, particularly those of us that were in areas, specialty practice, general practice nursing, which I had been very familiar with in my previous role as the CEO of the PNCB. Sandy also very intimately connected with school nursing and what that practice looks like. So we kind of just sort of asked ourselves, what are pediatric nurses doing? What do they do? What would be a good way of beginning to represent pediatric practice as we kind of know it now? And so one of the things we decided to do is just in this next quick half an hour, give you a presentation of some of the skill sets that we know we require on basic certification exams, our certified pediatric nurse exam, our school nurse exam. Those are two major areas, large populations of certified nurses out there doing great work. And so one of the things we wanted to do is just sort of walk you through this next group. Or just walk you through some of the information that we know about practicing pediatric nurses. First, want to give a special recognition to Dr. Donna Wong, whom many of you have known about and of for a number of years. She was essentially one of the founding mothers of pediatric nursing in many ways, and particularly involved in helping us at the PNCB establish our first general practice exam, which was launched back in 1989. Today, we have more than 20,000 certified pediatric nurses, and I wanted to give you a little bit of information about what we thought they were doing. We have a basic definition of pediatric nursing that we've attached to the certification exam, which I think many of you will agree with. A lot of health promotion, chronic illness management, health restoration, and it, of course, is the entire age span of pediatrics from infancy all the way through young adulthood, and we are also very much involved in family care as well. We have them, our general practice pediatric exam is designed for nurses in a variety of roles and a variety of settings, and we expect them to really do the nursing process, that critical decision-making that paradigm that we've had established for nursing for a number of years. One of the things that we are required to do in certification, and this is every discipline that has a certification exam, is that you must update that, because in fact certification by definition reflects practice, current practice. And so every 3 to 5 years, all organizations that launch a certification exam are required to actually update it. So you do a national survey of your population of practicing nurses, and you ask them what they're doing, and you give them a long list of tasks and knowledge statements, and you have them identify what's important to them and often what they frequently do as part of that importance activity. So our practice analysis for the certified pediatric nurse exam really looked at over 2,800 folks. We identified 72 important task statements, and these sort of began to serve as the foundation for the exam. As part of this, we also had them describe themselves. This is as I said, we have total 15,000. It's 20,000 now. This was a couple years ago. But about 11% of our population of certified pediatric nurses actually are not in the hospital setting. They're out in primary care settings. Most, as you see, are in hospital-based settings. We asked them, we got some information about their preparation. Most are baccalaureate or even master's prepared. Fewer associate and diploma preparation. Many of them have been certified at least 6 years. We have a requirement that they document at least 1,800 hours of clinical practice before their eligibility is determined. And what we have also found is that certification, and in pediatric nursing I've learned, is a very powerful ingredient to job satisfaction and longevity within an employment setting. So our nurses have, on average, stayed with the same employer 13 years. And somebody's been there for 49 years. That's true. And as we talk to these folks, we ask them about what their plans might be, and a 93% plan to stay with their current employer. So as we're talking about creating nurse resiliency, creating nurse affinity for the, your employer, certification is a quick and easy way to do this, and that's in any discipline, actually, school nursing and so on. One of the things we did is we mentioned we had 73 knowledge and task statements, so we began to organize those in the process that is consistent with our definition of pediatric nursing. And as you can see, these are some of the examples of the kinds of knowledge and skills that we expect pediatric nurses to have. And for assessment, we are looking at nutritional status, barriers to care, physical status, growth and development, really, really important. One of the things that we've been able to do in looking at the pattern of performance on certification exams over time is that we've always seen growth and development as one of the weakest areas. I mean, people are successfully passing the exam, but if I have to look at the area in which they're not performing as well as we often think they should, it's in growth and development. And that's not only the general practice nurse, but also the advanced practice nurse. Health promotion is a big area on the exam. We expect them to be able to answer test questions about environmental factors influencing health and so on and so forth. We also expect them to be very much involved in management of health conditions in kids, and that includes pain. We have an expectation about nursing procedures that they will have knowledge about, and so on. We have 5 illness conditions that we have seen emerge as our pediatric nurses report to us about who they're caring for. Respiratory, as you might imagine, should be no surprise, is the #1 critical illness or acute illness for most kids. Gastrointestinal is second. What's third? Infectious disease, there you go, somebody said that. Neurology and emergency and trauma. So those were sort of the top 5. Although, so our expectation about managing and interventions would really primarily deal with those illnesses. We also had a large component of the exam, I think upwards of 15%, related to professional role. And so there were test questions associated with, participation in disaster preparedness. As we did our recent role delineation study back in 2010, 08, 09, that was a brand new area that emerged. 5 years previous, disaster preparedness was not something that pediatric nurses were dealing with prior to 9/11. So it's something that's been emerged as a important practice area for pediatric nurses and in school health as well. And so as you look at our exam, these are the kinds of things that we expect the pediatric nurse to be able to attest to, their knowledge in all of these areas. Important, 40% is just basic assessment, growth and development, and health promotion. As we mentioned to you in your packet, you have the pediatric nursing scope and standards. And so one of the things that we wanted to sort of demonstrate for you today is that as we talk about our certification exams, school nursing and general practice peds, our standards and our content outlines really pretty much mirror the scope and practice standards that currently exist for pediatric nursing. It's assessment and diagnosis, outcomes, identification, planning, implementation, and evaluation. And we expect that there are 11 standards of professional performance, and all of these things should be threaded throughout their practice, and they should be accountable for these areas as well. And again, this is a great nursing scope and standards published by collaboration with the ANA, the NAPNAP, and SPN. And so that's my end. And now it's Sandy's turn.
Good morning. So I want to just give you a little bit of the subset of pediatric nursing, tell you a little bit about school nursing, and you'll see a lot of the similarities between that and the, some of the data that Jan has from the Pediatric Certification Nursing Board. So let me tell you what school nurses do. School nursing is a specialized practice and advances the well-being, academic success, and lifelong achievement of students. And you can read through this. School nurses facilitate positive student responses to normal development, promote health and safety, intervene with actual and potential health problems, provide case management services, and actively collaborate with others to build student and family capacity for adaptation, self-management, self-advocacy, and learning. Whew. And they do this all by themselves because pretty much they are a staff of 1 out in their buildings. So, from a membership study that was done recently, a membership survey, you can see a little bit of who school nurses are. The demographic breakdown, 92% Caucasian, 29 to 30% of this group are nationally certified. We have about 3,400 nationally certified school nurses. In addition to the national certification, a lot of our school nurses are state certified or credentialed, so they had to meet some criteria within their state to practice as a certified nurse. It's required in some states and recommended in others. 14% have 36 or more years of experience, kind of scary. And we are an elderly group. I think our numbers show that we're about 63% 51 years and older. Many school nurses go into school nursing. You need to have some experience in nursing before going out into the schools because it's such an independent practice. And 86% practice in public schools. This will show you the education. One thing you should know is it's very variable across the country. The requirements to be a school nurse in New England are very different than the requirements to be a school nurse in the South. And it varies totally across the country. 50% have bachelor's, 28% master's, 10% associate degree. We do have actually in some areas some LPNs practicing as school nurses independently in a few places. So there's huge variation. And the practice in general, in New England, in the state of Vermont, for example, there's a nurse for every 300 students. In the state of Michigan, there's a nurse for every 5,000 students. So as you might imagine, the practice varies tremendously. In places where the ratios are so huge, there's a nurse that pretty much coordinates the program, trains unlicensed people to provide care because there just aren't enough nurses. And it's not a lack of availability of school nurses, but funded positions. Most school nurses work directly for public schools, you can see in this graph, and all work within public health. Some are hired by public health departments as opposed to the local education agency, but we're all certainly doing population health in the schools. This is what full-time school nurse staffing looks like. About 40% of elementary school buildings have a full-time school nurse, and a little bit better at the middle and high school level. And again, the national variation is huge. So 55% of school buildings don't have a full-time nurse, but there's nursing services in some capacity in about 75% of our schools across the country, leaving 25% that have no nursing whatsoever. And you think about the kids that you're sending back from your hospitals that need care in their schools and who's taking care of those kids. So looking at certification, it's fairly similar to what you see, what Jan just presented from the PNCB exam, looking at health appraisal and health promotion. Interestingly, our most recent survey asked nurses where they spent most of their time to list the top 5 tasks that they were doing, that they spent most of their time. Only 10% put prevention in the top 5, which is pretty frightening to me because I see a huge role of school nurses being able to work with prevention and health promotion so that we can promote a healthier society. But I don't think it's lack of desire so much, but lack of time and staff to make it happen. But we have a captive audience of kids that we could be doing huge things with prevention. This was one of the questions on the survey. Does your school or district use electronic health records? Looking at potential new knowledge and practice competencies. And we have 56% that said they use electronic health records, which sounds pretty good. The downside of that is most of those are add-on programs to the school database programs, so they're not developed by nurses or people who really understand health and what they need to do, and they generally don't communicate with anything else. For example, in my state, we have a wonderful immunization registry. the nurses in our state in the schools are using probably 5 different programs, database programs, and none of them speak with the immunization registry. So if you're looking for immunizations for kids, you just need to go somewhere else, and then you have to hand input all of that data into your electronic database. So we have a long way to go with electronic records. And looking at emerging issues affecting school nursing practice, we certainly know the state of the economy. We know how many kids that we have that are underinsured or not insured at all, undocumented. And public health really does reach out for the schools, looking at how we can do that. So the school nurse frequently is really the only healthcare provider that some of these kids see. And is able to refer these kids out, but they don't have any other health care in their lives. We also know that the great advances in medicine and in technology have allowed a lot of kids who would not have made it to school age are now entering our schools and in need of a lot of health services in our schools during the day. We're certainly seeing a lot more complex kids that either didn't survive or were in more therapeutic settings coming into our schools. So our nurses need to be really state-of-the-art trained, have all that education and background to be able to keep up with what we're seeing in schools. And we also know the psychosocial health status of our kids. We've seen real changes in family structure. The economy has had a huge impact. So a lot of what we do, in fact, one of our survey questions was looking at what the major things that nurses spend their time on, and I think 53% said mental health. Mental health is, and you're all seeing it, it's just huge. And do we have the capacity to deal with that? What do nurses need in order to deal with that on a daily basis? I work in a middle school, and I will testify that mental health is definitely more than 50% of what I spend my time on every day. Looking at knowledge expectations, and you can kind of see the side-by-side comparison again. I'll call out health promotion and disease prevention, which is something that is huge and something we need to be able to spend more time with. And are we prepared to do that? And professional issues, another piece on our exam, looking at the scope of practice and nurse practice acts, and it really does become gray outside of the hospital setting. And this is where we find we're spending a lot of our time trying to define that the scope of practice for school nurses is the same scope of practice for any RN. It doesn't change when kids come into school. And there we are. So the question that what kind of brings us to our next activity is, are we preparing nurses for this? We looked at kind of got a snapshot of what nurses are doing, what pediatric nurses are doing, and are we preparing them for these roles as they change? Thank you.
Thank you, Sandy. Any questions? We're going to have a break before we continue with more PowerPoint. But any comments or questions thus far about our introduction slides? Yes, Ann.
You talked about nurses in hospitals and nurses in schools, but I think we're missing some emerging areas. With the Affordable Care Act, the early home visiting, where some states will be placing a nurse in that role. Some will be placing nurses supervising individuals in those roles. The other emerging issue that's really been there for a long time are our child care centers, where many times, in Head Start programs, where there's not a nurse particularly in that center, but many states have what they call nurse consultants that work with those programs. So I think we need to sort of look at where nursing has a fingerprint in terms of caring for children. I actually serve as the health consultant for our local Head Start program, and you don't need to be an advanced practice nurse to do that. You know, I just happen to do it because I like working with Head Start. But that has a great bearing where we have nurses in public health, And as we move more towards prevention, and if you haven't looked at the prevention strategy that was released, I think that pediatric nursing will be changing a lot of its focus. And I would ask for us just to kind of keep that in mind as we move on today.
Go ahead. Anne-Marie, did you have a?
I'm not sure how to turn this on, but I totally support that. And one of the things we did with this particular presentation is we had Jan talk, which is really more the hospital-based, and we had Sandy talk because of the community-based. And recognizing that pediatric nursing, I have no clue, but I'm loud.
He's coming. Oh, it's on. Okay, we're good.
The pediatric nursing is not just in the hospitals, but it's out in the community. And we couldn't do the whole breadth, so what we wanted to present here is most of us, again, see the children where we are, but they're not just where we are. They're all over the place.
Right.
And so when you're in the children's hospital, you need to remember that they go out into the community, whether it's to Head Start or schools, or some are at home and needing services in the home. And when you're out in the community, you need to realize a lot of our kids end up back in hospitals with specialty nurses, and we need to be talking to them. So what we just presented was a snapshot of the two broad areas where all of you are, in the organizations, in the hospitals, and out in the community, and school nursing is probably the largest group that's out in the community. So what Ian just said is exactly true. It's changing. When I started in pediatric nursing was the hospital. I mean, that's where I was, and that's where I worked, and I thought if I want to work with children, that's where I'm going to have to be. And I actually wanted to be a psych nurse, but there was no psych nursing for children. It was peds nursing, and so that's where we started. It's changed dramatically, and that's what's represented in this room. So thank you, Ian.
Yes, and Anne, you really brought up some good points, because I think as we get into our reporting of the data that we collected, we're going to see some opportunities emerge, and the ones you've just described in the public health arena, I think, are very important opportunities. And what I think we need to do is start retooling our thinking about ways to make sure that now that we know what the emerging healthcare needs of children are, their dire need for health promotion and prevention activities, that the information that we present will hopefully begin to help create new strategies for thinking about different ways of getting nurses that are interested in taking care of kids in the variety of settings other than the school and the hospital necessarily. Yes?
I just wanted to join Sandy's comment about the behavioral needs of the pediatric population. I feel like there is a huge empty place where we are not meeting in the inpatient setting as well as in the clinics, in the community, at home. We are really having trouble hitting that, and the preparation at the baccalaureate level is minuscule around behavioral needs of pediatrics, and it's something I hope we get a chance to talk about and look at this week.
Well, and you're absolutely right, and as we talk to the major organizations that are managing children's hospitals, the National Association of Children's Hospital and Related Institutions, NACRI, CHCA, we hear from their leadership the same issues. They have a big obesity prevention initiative within NACRI because that's a huge public health issue. And so understanding what we're teaching undergraduate students about nutrition will be important to be aware of as well.